From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Welcome back to Good Morning Arkansas. Great to have Dr. Laura Wilson here of the Sherwood Family Medical Center. We're talking about headaches, not the ones they give us, but the ones that they have. And apparently there's some causes that if they do have headaches that we can eliminate.
Right. So first I want to talk about how common they are, because parents tend to panic when kids complain of headache. And I'll tell you, even as a mom, when my little girl came to me the first time, I kind of did the panic mode.
Sure.
But there's really no need to panic. Most of the time, headaches in kids are just headaches and not really a source of anything more serious. We estimate 50 to 70% of kids will experience some bouts of headache during childhood, and 10% of those may be chronic migraine sufferers. So we're talking very common. The good news is less than 1% of these tend to have an organic cause. So less than 1% tend to have a brain tumor or something more serious, which is, of course, every parent's fear when they come in to see me.
We always immediately go to the worst case scenario.
Of course. And, you know, thankfully, it's just very, very rare. Now, it's something always we're looking for, but it's very rare. But most of the time, again, it's just headaches. Just like adults get headaches, children can too. And the most important thing is kind of to look at your headache hygiene. So we talk about sleep hygiene. This is kind of the same thing, but with headaches, right? So first, I want people to keep a headache log, and this is just writing down their symptoms. How bad is the headache? Where does it hurt on your head? Did it happen in the morning? Did it happen in the night? How much did you sleep the night before? Just trying to kind of quantify details of the headache to see if there's a pattern to look for triggers, right? Perhaps a specific food.
Pieces of the puzzle together.
Exactly. Right. So keeping that headache log is important. Quality sleep, very important. I know myself, I get migraines. If I don't get a lot of sleep, I'll tend to have a headache. So getting that 8 to 10 or 11 hours of sleep, depending on the age of the kid, is very important. Limiting caffeine, right? We know caffeine highs and lows can really trigger headaches, especially if you're a chronic caffeine user and then you don't have caffeine. Everybody knows about a caffeine withdrawal headache.
And that applies to adults too.
Oh, of course. And I hope most kids aren't doing a lot of caffeine.
They don't need to be Starbucks.
But it's surprising, really.
Yeah.
We also want to limit over-the-counter pain relievers, so Motrin and Tylenol. Those, of course, would be fine to use here or there as needed for a headache. But if you use those more than 2 times per week, you actually can have what's called rebound headaches. So when the body does not have that medication on board, the headache comes back.
In kids, headaches can't be, are they all that common in kids? Because I know a lot of headaches in adults, it's caused by stress.
Right.
And the kids don't have that much stress.
Well, actually, you'd be surprised.
Maybe they do.
So the kids that come home from school with headaches, that to me kind of signifies more of a stress headache potentially. Right. I mean, sometimes it's not a direct stress-related thing. Sometimes it is just a headache. But yeah, in kids, sometimes we'll see stress-induced too.
So you're saying 99% of the time, one of those factors or a combination of those factors is the blame.
Right.
But then that 1%, what
Right,
are we
so
looking
there's
at?
always the headache that's a little more worrisome and what we call red flags or when to worry. First would be obvious concerns. If there's been trauma, I mean, if there's a head injury and you have a headache, if there's a fever associated with a headache, if there is weakness, like one-sided weakness, I think those would be fairly obvious to parents that that's not just a chronic childhood headache. That would be reason for your child to get seen. Also, the pattern of the headache is important to me. So mild or even moderate intermittent headaches is not as worrisome to me as a kid that's having them more frequently with increasing intensity, right? So kind of this upward slope of frequency and intensity is concerning for me. If these headaches wake the child up in the morning, that's concerning. It doesn't mean something bad, but kind of a red flag, deserves an evaluation, or if there's associated vomiting. And that could go with migraines, but also could go with something a little more serious. So those are kind of the big ones that we might take a little more seriously and evaluate that child a little different than a child just with the, again, mild to moderate intermittent headaches.
Part of having a kid is they're going to bump their head. They're going to knock their head on something.
Oh, yes.
And and it's painful. You feel a little knot on their head. I would assume that a headache is normal, but what point do you think, okay, maybe there's something serious that may have happened in that bump?
Right. So I don't know very many kids that have not had some big fall with a knot. I should throw out there the idea that if it comes out instead of in is a myth. There's no truth to that. Have you heard that one before?
I've not heard that. Don't tell me about it. I don't want to hear it.
Okay, I'll quit there.
Don't fill my mind with that stuff.
But if we have a head injury with loss of consciousness, with repeated vomiting afterwards, or again, kind of with obvious weakness, sleepiness, those are red flags, okay? So if you bump your head, you can have a ginormous bump up there, but the kid cries for 5 minutes, then consoles, acts fine, you know, drinking okay without vomiting, it's probably not anything too serious.
Good. It'll probably go away on its own.
Probably.
All right, your information over at the Sherwood Family Medical Center.
You got it.
It's your phone number?
835-0703.
All right, thank you so much for coming on the show today.
Todd.